Installing the airway. With the included lubricant, thoroughly lubricate all of the outside surfaces of the airway and around the mouth of the simulator. Gently insert your lubricated finger into the airway. Push the tube end of the airway into the mouth of the simulator and slide the airway down into the head, making sure to free the lips as the airway slides into place. Gently pull up the defibrillation chest insert. Please use caution to not detach the electronics and slide the tube from the airway into the hole at the top of the chest insert. Fit the chest insert back into the chest cavity. To install the defibrillation chest insert and connect the interactive ECG simulator, remove the wire from under the white plate in the base of the chest cavity. Please note that the white plate is adhered to the body of the simulator and removal of the plate should not be attempted. Connect the wire from the defibrillation chest plate to the wire extending from the base of the chest cavity. Fit the chest insert back into the chest cavity. Next, screw the round defibrillation adapter posts into the defibrillation chest skin and into the post site on the posterior of the simulator. Now, attach the defibrillation cables coming from the left side of the mannequin, labeled sternum and apex, to the interactive ECG simulator. Connect the 4 colored limb leads coming from the left side of the infant simulator to the same colored snaps on the side of the ECG simulator. Now connect the limb leads from your defibrillator or monitor to the appropriate anterior sites on the infant simulator. Chest tube. A chest tube may be inserted into the site on the left midaxial line. This is a non-functioning site that may be used for practice in chest tube care only. Moving on to the IV hand and foot. Dip the non-fitting end of the vein tubing into the provided lubricant. Feed the tubing through the lateral hole just above the hand. Form a loop over the vein channel. The loop should be approximately in the middle of the vein tubing section. From the medial side of the vein channel, feed the tubing through the remaining hole. Adjust the tubing so that it lies securely in the channel. Attach the lure fitting to the open end. Generously powder the inside of the hand. Gently pull the skin over the hand, taking care not to dislodge the vein tubing. You will follow the same procedure for the foot. When finished, connect the hand tubing to the foot tubing. You will connect the free ends of the hand and foot tubing to the fluid supply bags. The left arm of Charlie will accept a 2 French catheter via the molded access site. Lubricate the PICC thoroughly with a supplied lubricant before insertion. This site is intended for practice site insertion and care only. Do not attempt to infuse fluids through the PICC line. Intraosseous leg. The left leg of Charlie incorporates an intraosseous infusion feature. Palpable landmarks include the patella and the tibial tuberosity. Any commercially available intraosseous device may be used to place the needle. The bone is pre-filled with stimulated blood and will provide flashback when the needle is properly inserted. To install the bone, correctly position the bone in the leg cavity. Then add a light dusting of baby powder on the inside of the skin and slide the skin over the leg. Patent umbilicus. The umbilical stump features a patent umbilical vein and 1 patent umbilical artery. Up to 5 milliliters of fluid or simulated blood may be infused into or withdrawn from the umbilical reservoir through either vessel. To fill the reservoir within the abdomen, gently pull the umbilical stump free from the abdomen of the infant simulator. Be cautious not to disconnect the pulse system. Using the supplied syringe, depress no more than 5 milliliters of simulated blood or fluid into the abdomen. Replace the umbilical stump, being careful not to kink the tubing for the pulse system. Gastrointestinal. The left nostril will accept an 8 French NG tube that will pass into the small tube embedded into the chest cavity of the infant simulator. It is important to note that this is for tube placement only, and no fluids should be infiltrated into the simulated stomach cavity. Pulses. C.H.A.R.L.I.E features 7 functioning pulse sites: the right femoral, the left femoral, the right brachial, the left brachial, the right carotid, the left carotid, and the umbilical stump. The pulses are manual and can be simulated by attaching the squeeze bulb to the site and squeezing at the rate you select. Genitals. The male and female genital inserts may be used interchangeably. The genital inserts are for catheter placement practice and not designed to deliver fluids. The anal opening may be used for the administration of rectal medications in suppository form. Do not attempt to infuse fluids. To interchange and install the genitals, select either the male or female genital. Apply dusting of baby powder to the back side of the genital insert and slide the insert into place in the infant simulator. Defects. 2 birth defects are included with C.H.A.R.L.I.E: an omphalocele birth defect that fits over the patent umbilicus, and the neural tube defect that fits into the hole on back of the infant simulator.